But I wanted to ask you why physical therapy private clinics, they're effectively locked out of this reimbursement model, why they cannot claim the same type of tax loophole.
Yeah, so in most states, there's different reasons, but I'll give you sort of the top three. So I'm sitting today in the Commonwealth of Kentucky. And in our state legislature, our Kentucky revised statutes, you will not see physical therapy, occupational therapy, or even speech therapy as allowable providers under the Medicaid system. And it's because, quite frankly, there weren't freestanding outpatient private practice, PTOT, and speech clinics when the Medicaid program started. And so nobody has gone back into the legislature to expand their coverage for PTOT and speech. And if you think about it, if we try to go to the legislator and get them to expand Medicaid, they would look at it as an expansion and an additional cost. The irony, as you well know, is we're a low cost producer. We're the best bargain in the healthcare, economic change. So that's one reason. A second reason is you will see in some states that the provider tax is limited to physicians or hospitals within certain environments, hospital or institutional environments, as opposed to, physicians in the environment. And then the third is that if you're an academic institute, you get additional IGT or intergovernmental transfer benefits that not only capture the inpatient side, but the outpatient side. So it's really a function of the different rules and things that are set up in the variety of states. I am unfamiliar with any PT practice in the United States that qualifies under IGT unless they have a hospital affiliation and they are effectively billing under the hospital. And there may be some examples of those. And in those cases, those providers pay a provider tax. And then obviously they pay $1 to get $1.80 or $2 back.